Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, and welcome back to another amazing episode of Straight Outta Health IT. Today, I have a topic that at first I struggled with a little bit personally, just because of where I grew up and the impact that this particular system had on my community. But more importantly, really starting to ask myself personally, what am I doing to start to support and address folks who are impacted by this system as well, too. And so today we're going to be trying to understand the impact of incarceration on the overall health in the United States. And I titled this episode, We Are Our Brother's Keeper. In the United States, the issue of incarceration is a multifaceted and complex one, with profound implications for individuals and families and communities. Beyond its legal and social dimensions, the state of incarceration in the United States has a significant impact on the overall health of those in prison. From infectious diseases to mental health disorders, the challenges faced by incarcerated individuals underscore the importance of addressing health disparities within the criminal justice system. The United States, sadly, has the highest incarceration rates in the world, with millions of individuals behind bars at any given time. As of March of 2023, publication of the Prison Policy Initiative, a nonprofit organization for decarceration, it's estimated in the United States that almost 2 million people were or are currently incarcerated in federal state prisons as well as local jails. This is a staggering number that reflects not only the scale of the criminal justice system, but also the diverse health needs of the incarcerated population. So today we want to explore the state of the U.S. prison system and the health disparities that exist for women and men who are incarcerated. And who better to have on this program today than my friend and colleague, Melissa Denino. Will today share her insights and some of the work that she's doing as an advocate of equity healthcare for the incarcerated women and men. And she'll share her own personal story related to this as well. So who is this amazing woman? Melissa currently serves as the director in market access practice for Innsena, a health tech consultancy focused on supporting underserved communities. Melissa leads work for organizations ranging from startups to public-private partnerships, helping them to navigate the complex Medicaid and public health markets. However, Melissa's true passion is supporting justice-involved individuals and their families, leveraging Medicaid to help reduce recidivism. She volunteers her time toward this effort and leverages her background in provider administration, health information networks, as well as her lived experiences to make a real difference. She sits on the community council for the Realness Project, a 501c3 that works with incarcerated people to address trauma and teach communication, relationships, conflict management skills, and she supports the community-oriented correctional health services. In her spare time, she also is the community moderator and manager of Health Tech Talk Show, a live show covering the health tech industry every Friday, with some of the amazing moderators on that show as well. So I'll let her talk a little bit about that later on. Welcome, Melissa. Thank you so much for joining me today to discuss this very important topic. And before we really go and delve into some of the specific issues associated with this, I always ask my guests to share with me and share with our listeners, why and how did you get into advocating for men and women who are incarcerated, and how did you become a part of this initiative itself?
Hi, Christopher. Thank you so much for having me on today's show. I would love to go into the reason behind that. So unfortunately, in my past lived experience, I've come into very close contact with people within my family and that are impacting my everyday life that were unfortunately brought into the system for whatever reason that may be. I made a mistake. People make mistakes.
Yes, they do.
And ended up serving time for those said mistakes. And everybody should be given the access to the healthcare that is needed within that time frame of having to serve your sentence. And unfortunately, the individual that I'm referencing was not adequately equipped to move forward after release. He continued to go in and out of the system with substance use disorder and mental health issues and was unable to navigate the system appropriately, thus causing further turmoil within the family. And unfortunately, was never really fully addressed during that time. Later on in life, they did manage to get through the system and able to get the proper care that they needed. But unfortunately, it took an extremely long and exasperated period of time and conflict and issues upon issues trying to make sure that they got the proper care that was required.
Exactly. Well, first of all, thank you so much for being transparent and sharing your journey in this space as well. I think many people that might be listening may have friends, family, loved ones, or know of someone who has been incarcerated, not necessarily because they were bad people, but they were dealing with a whole host of other issues, whether it was behavioral health issues or substance abuse or trauma in their lives. And as a result, were caught up in the U.S. criminal justice system and never received the proper care that they needed to return back to society in a very positive way. So I guess the first question I want to ask you is, can you provide from your perspective an overview of the current state of the incarceration in the United States and its impact on public health?
Absolutely. So obviously, they often experience higher rates of chronic and infectious diseases compared to the general population. They have limited access to healthcare. Mental health and behavioral health is little to never really addressed within the system. They have a higher prevalence of risk factors that contribute to the disparities that I'm referencing. Just in general, they just have a higher rate of tuberculosis, HIV/AIDS, hepatitis, chronic conditions like diabetes, and then obviously the food that's being served within the system. And the lack of education is just a perpetuating situation that just continues this issue.
Sure. And I can imagine also the violence that happens in many cases within the system itself can have a traumatic impact on their mental health and physical health as well, too. And just under that constant state of survival, right? I can imagine.
Not only that, but there also being the lack of privacy, which I understand those are issues, but the lack of privacy and then the complete opposite spectrum of being in solitary.
Right.
And then being coupled with having a mental health disorder, those things are just recipe for disaster.
No, absolutely. Sad. It's a sad commentary that our system has gotten to a point where we're focusing more on incarceration versus rehabilitation. And why do you think that is today? Why has our system moved away from this concept of preparing people to be able to become a productive citizen once they've served their time to one where they're just housing them and unfortunately, in some cases, making them worse off when they come out than when they started?
I don't think it's an intentional outcome. There's always been a lack of communication between the justice system and the healthcare system. They also have significant challenges due to conditions within the correctional facility. They have limited staff. And then because there's always been a divide between the two, they don't have the proper care within the justice system. And then with the Medicaid exclusion policy, when they go in and they're no longer covered by Medicaid, that no longer becomes the problem of the Medicaid itself, but the correctional facility are required now to pay for those services. So the lack of actual funding to be able to provide those facilities with the proper care that's needed upon release. And then add into the things such as technology that's completely overhauled our society. Just the simple thing of having a phone. Nobody has a cell phone upon release. How are they supposed to be able to communicate and have those social skills that they're supposed to have with the community and support within their family or individuals that might be going through the same situations as them, making sure that they have the right access to care? They can't even confirm their appointments. They have these people and social workers and parole officers that are assigned to them, but in many cases have no way of communicating with them other than possibly the housing authority in which they're staying at. In most cases, those things fall through.
Well, access to care within these facilities, to your point, is a critical issue. And while they're incarcerated, they should have the legal right to receive services such as medical treatment and mental care and substance abuse treatments. But clearly, there are barriers. You talked a little bit about some of the understaffing and limited resources and these administrative hurdles that really impede timely care. And as a result, their needs go unmet and are inadequate to address their current challenges that exist. Talk to me a little bit about, or expound a little bit further on some of the factors like healthcare and overcrowding and environmental conditions within these facilities and how they might have a direct correlation. You touched on a few, but are there any others that you might want to share your thoughts on as well?
I just want to also state that the overrepresentation now of mental health and substance use disorders within the system, back when this whole entire system started,
Sure.
The education that is now available was not available at that time. And the importance of making sure that the staff has those resources is a necessity. Right. And it's, like I said, the lack of funding is unbearable to be able to provide these services.
So what services are currently available to someone that's within the prison system? I mean, what can they advocate for or themselves?
At this time, it depends really where you're located and what state you're in and what individual access to care is provided within the correctional facility that you're located in. Mm-hmm. You're going to get what you're going to get. It's a prison system, and it's unfortunate. Right. There are states that are going towards the Medicaid. There's a Medicaid 1115 waiver that is out right now that is looking to provide Medicaid services and Medicaid to be reestablished 30 to 90 days prior to release. And what that does is allow for those individuals to get the correct care and the continuity of care upon release and get the medications that they need upon release and make sure that they're hooked up with a mental health provider and that they're hooked up with a substance use disorder provider and that they have social services that are available to them. And those are all things that are provided through Medicaid. So in those states specifically, not that I know that maybe an individual that's incarcerated might not know these things as of yet, but California and Washington just became the first two to pass the 1115 waiver where they'll get 90 days prior to release, they'll get that Medicaid. And there's, I believe, not 100% sure, but I believe there's 17 more states that are in the process of doing so. So advocating for those services and the individuals and states advocating for those Medicaid 1115 waivers to be active within their communities so that this would be resolved or at least have a better impact upon release is a huge thing that I would say would be an advocate. Not necessarily for the individuals incarcerated, but those that are outside.
Exactly. No, that makes sense. I'm curious, as I put my technology hat on, are you seeing a greater adoption of things like telemedicine, virtual care services within this environment, or is that still very...
I personally am not to say that is not taking place. I do know of certain locations like Camden County, New Jersey, Camden Prison System has a really good program with Cooper Hospital. Mm-hmm. And they have a referral integration service system where they're able to see the inmates or patients are going back and forth, and that information is being retained within the electronic health record. And that's because I believe the provider that they have on staff is very intuitive and very innovative in this scenario. I'm sure that there are telehealth services that are being provided, but like I said, that I'm sure those are far and few in between.
Right.
And again, depending on who's running those jail systems, because it really does come down to who's running those things and what they want to see happen.
Right. And so I want to touch on something maybe a little controversial as well, too, and that's the privatization of the correction system.
It's money.
Yeah, it's money. I'm just curious your opinion about whether or not does privatization benefit those who are incarcerated and getting better care, or is it worse because of that, or about the same? I'm just curious, what's your perspective on the whole privatization of the correction?
Christopher, I am by nature.
Looking on my script that I gave you.
not providing this to me today. Okay, so let me just start with, I am an optimist, and I believe that all people inherently want good.
Sure.
And they want good for others. They just get greedy. And that's all I'm going to leave at that point, because privatization refers to greedy. And that all
from other people.
Yeah. And that all equates to money. And unfortunately, all of this is a business.
Right.
And people get forgotten, left behind, and they're looked at with the stigma. Understandably so. People don't necessarily want to they're looking at it like this person did something incorrect or hurt my family. But in the grand scheme of things, in the reality of life, those individuals are most likely going to be out in the community again.
Right.
And hopefully they're going to stay out in the community because we want them to get better. We don't want them to reintegrate into incarceration. We don't want them to redo the same mistakes.
Ideally, right?
Ideally. And like for all those that have had issues and unfortunate circumstances to their families due to an individual that was incarcerated, my heart bleeds for you. But the reality is that if they come out and they go back in, it's because something was done wrong again, and we did not address the problem.
Exactly. It's the old saying, continue to do the same thing over and over again, expecting a different result, right?
It's the definition of insanity.
That's right. It's insanity. It's insane. Absolutely. So let's expound a little bit further on that reentry and the continuity of care as well. The transition from incarceration to the community is absolutely critical juncture for these individuals to hopefully live a healthy and rehabilitated life going forward. However, many face significant challenges. Again, you mentioned some around the health, housing, employment, social support upon release. Without these adequate support systems in place, formerly incarcerated individuals usually relapse, right? They go back into the system, whether they're homeless and they're trying to just survive, or having issues with family who don't know how to manage them after they come out or support them after they come out. The recidivism rates, there's a challenge there. So I'm just curious, how does the healthcare industry, or how do we as a society need to support these individuals and provide some sort of mechanism to help influence them and not going back into the system, not repeating the same thing over and over again?
It's a really tough question, and I wish I had an answer. I'm gonna jump into the organization that I work with, which is the Realness Project, and they're based out of Colorado, and they work with the Colorado Maximum Security State Prison and the Women's Prison in Colorado, and they go in and provide habilitation, not rehabilitation, because we are under the impression that they've had these things before in the past and we're rehabbing them. But in actuality, in many of these individuals' lives, they've never had security. They've never had conflict resolution. They've never had support.
Right.
And assuming that these individuals had all of these things and that we're going to rehab them is an error in itself.
Sure. Yeah.
Going in and thinking that they might never have had these to begin with is really the jump off point where you should start.
Yeah. That shifted my paradigm. I never really thought about it from that perspective.
It blew your mind. Blew your mind.
Wow.
Yeah. So it's habilitation and teaching them the skills that they didn't.
I've never had.
Yeah. So the Realness Project, it's great because this past weekend I went to a retreat to learn the authentic relating training that they provide within the jail systems.
So what does that mean? That says a lot.
It's a lot. So as a everyday person, not dealing with incarcerated individuals every day, not being in the jail system, they are teaching conflict, not resolution, conflict transformation. They're not, de-escalating of a situation, not nonviolent communication was one of those things of topic. And just the agenda itself, like why it's not adopted and incorporated into more prisons. But as a person who's not in prison, addressing your feelings and speaking in a way and in a manner that is non-conflictive is very difficult. And being in the confines of a system where you're constantly being watched and you already are having disparities and health issues and you're missing your family and you're probably down on yourself, I feel like those scenarios are probably harder to address in a non-conflictive way. So I completely forgot what your question is, and I'm on a tangent.
No, you answered it. No, exactly. I was just thinking too, hell, it's hard to communicate your feelings and not incarcerate.
Someone that you want to have it like an amazing relationship with. So anyway, so 48 hours of me being in like a center and learning all about my feelings and like how to properly communicate them in a non-conflictive way. And it was hard. And now to couple that back with, I found the Realness Project through obviously my passion, and Lori Lazar is the founder and runs the program. And she was amazing and allowed me to go to Colorado, and I went in the maximum security prison with her, and we were in the gym with, 20 individuals, and she was facilitating this program, and to see the reaction on these people's faces, like the story, and part of this was to tell their story as to why they got there. And the mental health, not that they necessarily have mental health issues, like undiagnosed problems, but the family and the background and the circumstances that led them to this scenario are heartbreaking. And them addressing, obviously not everybody is like this, but them addressing the problems that they had and what led them to get there. And then in turn also acknowledge the fact that they need to change within themselves. And are willingly taking these courses.
Says a lot about them.
Exactly. Giving these people resources that they need to just be able to communicate within the system, not upon release. It's a huge dynamic that should be addressed.
No, absolutely. And I think that's an important commentary as well, too, is that some people enter into these systems not because they're bad people, but they had bad things happen to them. And as a result of that, they've had to figure out how to cope with life and might have made bad decisions that led them to this place, or may have been just unjustly treated, or there could have been a number of other factors. But the point being is these folks want to be better. They want to get help. They want to figure out how to improve their lives. And I think we sometimes as society look at people who are incarcerated as the kind of the lower ring of society. They deserve it. They don't deserve a second chance. They made these decisions and they got to live with them. Not that sometimes they were victims themselves. That's what put them in that place. And I'm just curious, how did you feel walking into that facility and being in that environment around the inmates?
So like I said, my personal life, somebody very close to me. I didn't feel
not your first rodeo.
Not my first rodeo. It was not that uncomfortable. There was a partition in the past, but so walking in to the gymnasium, but it was a little disarming at first, but they were extremely welcoming and appreciative. I actually went back. I went the first time to see the facilitation, and then I went back to see the graduation of the ceremony.
Yeah.
And they had their family come in, and they had dinner, and and some of them are never leaving. There were lifers in that program, and they just wanted to be better for themselves. And on top of that, they're around those people that are going to get out. So you want them to be able to communicate and have those conversations.
Exactly.
It was different. That was it.
I can imagine. Life-changing for sure.
Yeah.
We're getting close to the end of this segment, and I got to have you back. This is a topic that needs to be explored further. I'd love to have someone on who's gone through this program as well.
There's a woman that is actually now working with the Realness Project. She just got released.
Yes.
And she's working towards helping other individuals that are incarcerated through the program. And this is her goal. She's got a great story. I would love to put her in contact with her.
Well, we have to have her on the program and bring you back and have a joint conversation about this as well. If you could share one insight, one thing that you want our listeners to take from this conversation and the work that you're doing, what would that be?
Stigmatizing the incarcerated is only hurting us. It's not it's not hurting them. They are already stigmatized. They already know that they're looked at a certain way. Exactly. You're hurting their kids. You're hurting their parents. You're hurting the community that they're in. They already know what you think of them. You're just perpetuating that.
Absolutely. Great statement. So if someone was interested in volunteering and doing what you're doing and being their brother's keeper, right? How could they contact you or contact this organization or other vehicles that you would recommend for them?
I have numerous emails, so you can contact me through email, Denino@Innsena.com. But you can also jump on the Realness Project's website, which is realnessproject.org. They do have something called the Ripple Effect, where you can donate as little as $5 or a monthly donation, and that will go toward the books and the upkeep to make sure that they're able to continue this program within those systems.
Well, we're going to have to leave it at that. Thank you so much, Melissa, for joining the program and sharing this story and giving us a different lens on those individuals who are incarcerated and the challenges they have with their overall health, both physically, mentally, spiritually, and the amazing work that you're doing and others are doing to support them. So we are our brother's keepers. Thank you for shedding light on that. And for those who are interested, Melissa shared her information and also be in the transcripts as well, too. Well, that's it, guys. Another episode of Straight Outta Health IT is in the books. I so appreciate you taking time out your busy schedule to listen in. And as always, your feedback and thoughts are always appreciated. Until next time, take care and God bless. See you soon.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.